Welcome to Accessing Dementia Services and Support. This session is aimed at both people who are living with dementia and those who are supporting a person living with dementia, and provides information to assist you with the process of accessing services and supports to meet your changing needs to ensure you have the support you need when you need them.
This session will cover available services in BC, navigating the system, how to access services, and tips to make the process as smooth as possible. We'll also touch on the legal authority to make these decisions. Our discussion about accessing dementia services and supports is in the context that most forms of dementia are progressive. As the disease progresses, a person's ability to function independently will decline. Throughout the journey with dementia, both the person living with dementia and care partners will need different types and levels of support and care. Let's start by looking at what services there are to consider. To start with, each of us have our own informal support network, and that network includes us here at the Alzheimer's Society of BC. There is the public healthcare system, and we'll be taking a look at what they offer and how to access their services. And there are private sector services, that is, services that you can pay for. Anyone can purchase private care if you are not eligible for public services or to supplement them. However, this session does not include information or discussion about specific private service providers. So, what is our informal support network? It is the friends, family, and people in your community that you have ongoing communication and relationships with. This could include children, grandchildren, other relatives, friends, neighbors, people you know from a book club or church or community organizations like senior centers, and from the Alzheimer's Society of BC. This group is sometimes referred to as a natural support network. There are two things to keep in mind. First, accept offers of help from others. People who offer to help usually want to help but don't know what to do to help. If you really can't think of something specific they could help you with, ask them to come and visit the person living with dementia and use that time to take a few minutes for yourself to do some self-care. Or thank them and let them know you appreciate the offer and that you don't need help at this time, but you can keep them in mind for the future as things change. This makes it easier to ask for help in the future. Which leads to the second thing to keep in mind: ask for help. Anne Wilson-Schaaf says that asking for help does not mean we are weak or incompetent. It usually indicates an advanced level of honesty and intelligence. But for many of us, asking for help is very difficult. I'll share that we often hear from both care partners and people living with dementia that they are worried about being a burden or adding to others' workloads. Some people worry that family might take the need for help as a sign that the family should take control, or they worry about how the person living with dementia will perceive receiving help, or that they might resist the help they are trying to give. We'll talk more about that later. There is a helpful resources document linked in the description of this video. That includes a number of helpful documents and resources. Specifically, you'll find a link to a document called Asking for Help. I've got a sample showing on the screen. This is a tool to help you organize the different tasks that you would like help with. Once you've filled this out, have a conversation with each person on the list and ask them directly whether they would be able to assist you with the tasks. If there are people in your personal support network who've offered to help, keep them in mind or show them the list of things that you could use help with and ask them to choose something. By doing this exercise, you will help those who want to help by identifying things that you need help with. As well, your family and friends may not be aware of a specific task that you need help with. This will also help you to identify the tasks that you need to look outside of your informal support network for. For example, maybe you need someone to mow the lawn but don't know anyone you could ask. This may be a job that you decide to hire someone to come and do safely. By getting this information, you are on the right track. The Alzheimer's Society of BC's First Link Dementia Support Services are a valuable resource to help families live well with dementia. Part of our mission statement is that we ensure people affected by dementia are not alone by educating and mobilizing a broader community of care around them. That's what we are doing in this session today. We are a non-for-profit organization, not part of the formal healthcare system, and independent of government ministries. We have a variety of programs and services available, including First Link Dementia Helplines, First Link Dementia Support Services, education, both in-person and online sessions, support groups, resources, and Minds in Motion. In the Helpful Resources document, you'll find a link to a page where you can sign up to receive our information bulletins, including our First Link bulletins, which are the quarterly listing of education workshops available around the province. There are a number of services in the public healthcare system available to support you at many stages along the dementia journey. You might start with the services available through home and community care, including home support and home nursing, adult day programs, and respite care. We're going to talk more about each of these coming up soon. Our public healthcare system provides support for the transition to long-term care if and when it becomes necessary, as it does for many people. And end-of-life care, providing quality of life for people at the end of a terminal illness or preparing for death. These services can be provided in home, hospital, hospice, assisted living, or care home. A big part of what we can help with is what we call navigating the system. This flowchart, also linked in that Helpful Resources document, is a general overview and not an exhaustive list of the different access points for accessing the various programs and services available to you. But it is a useful demonstration of how each service is distinct from other services. For example, home and community care, your family doctor, the Alzheimer's Society of BC, private care, etc. Because of the progressive nature of dementia, most families need additional support along the dementia journey. Let's look a little bit deeper at services available through home and community care. There are 4 primary areas of support that you can access through home and community care. The first is home care nursing. These nursing services are designed to help people remain at home for as long as possible. The focus is on medical care, and the service is often offered after illness or injury or discharge from hospital. This includes both nursing and community rehabilitation services. While the goal with home support services is also to help people remain at home as long as possible. In contrast to home nursing, home support services are specifically defined in the Home and Community Care Policy Manual as personal assistance with daily activities as opposed to medical care. Service is provided by a community health worker or care aide and can include help with personal care activities like bathing, dressing, grooming, and light household tasks. According to home and community care policies, it only includes light household tasks that may help maintain a safe and supportive home. Services do not include cooking and cleaning. You can also purchase private pay services to help you with cooking and other chores, or check to see if Better at Home offers these kinds of services in your area. Adult day services provide supportive group programs and activities, and the programs may include recreation and social activities, personal care services, meals, and transportation. A person can attend a day program in addition to receiving other services such as home support from the health authority. Adult day services have a dual purpose. We often think of these services as providing respite for caregivers, but equally they provide important engagement for people living with dementia and give them social time to be out of the house, engaging in stimulating activities. It is as much a break for the person with dementia as it is for the caregiver. Respite might be provided in the home, but usually the person is temporarily admitted to a respite bed in a long-term care home. Respite can be used as both a break for the caregiver and the person living with dementia. It is a helpful resource if the caregiver needs to travel out of town for work or personal activities, or if the primary caregiver has surgery scheduled and won't be able to maintain their caregiving role for a period of time. If you are eligible for home support services, then you are eligible for up to 30 days of respite care per year. Talk to your case manager through your health authority to find out more. To access home and community care or home care services on the Island Health Authority, the easiest and most accurate thing to do is to go to the Government of BC website at www.gov.bc and click on Health, then Accessing Healthcare, then Home and Community Care. On the left, you'll find how to arrange for care. Language may vary from one health authority to another. For example, all of the health authorities except Island Health refer to as what we're talking about as home and community care. Island Health, however, has changed the name of their program to Home Care Services. But regardless of the terms used, they are all required to follow the same legislation and provide the same necessary services. A useful document provided by the government is the Home and Community Care Policy Manual that we've already referred to. It's a detailed policy manual used in all 5 health authorities. It describes eligibility for services and access and explains the process for determining the rates you will pay. On the Government of BC website at www.gov.bc, look for and click on Health, then search for Home and Community Care Policy Manual. Again, these links are in the Helpful Resources document. So, how do you get in touch with home and community care or get a case manager that I've already made reference to? A referral to home and community care can be initiated by family members, doctors, social workers, neighbours, or anyone else who has concerns about the individual. You can contact Home and Community Care Office in your health authorities to request an assessment for services, or healthcare professionals such as a doctor, nurse, pharmacist, or social worker can also make a referral on your behalf. When a request for an assessment is received by your local home and community care office, a healthcare professional will contact you to determine your eligibility for services and arrange to have a needs assessment conducted if appropriate. If an assessment is not required or if you are not eligible for home and community care services, you may be referred to other appropriate resources. If you don't get the help you need, feel free to ask for other resource suggestions, and you can always reach out to the First Link Dementia Helpline, who may have a list of resources available in your community and that contact number to get in touch with the Home and Community Care Office in your community. To be eligible for subsidised home and community care services in British Columbia, you must be a Canadian citizen or have permanent resident status or have been issued a temporary resident permit by the Federal Minister for Immigration. You must be a resident of British Columbia for at least 3 months and be 19 years of age or older. There are some exceptions to the 3-month residency requirement and the age requirement. If you need more information, speak to your local home and community care office about the exceptions to these requirements. To be eligible for services, you must also be unable to function independently because of chronic health-related problems or have healthcare conditions that require care due to one or more of the following. You have recently been discharged from acute care hospital, or you require care to prevent or reduce the need for hospital or emergency department services or admission to a long-term care home, or you have a life-limiting illness. In addition to meeting the criteria already described, each service may have its own needs assessment criteria that you must meet. Talk to your health authority or review the criteria listed on the Home and Community Care page on the government website. Fees charged for public services are income dependent and based on a sliding scale. There is no daily charge for case management, home care nursing, or rehabilitation services. However, home support services, adult day programs, and respite care all have a daily charge depending on income. It's important to note that fees may change over time, and you can always obtain more detailed information on fees from the local health authority. So, what can you expect of a home and community care case manager? Their role is to act as a coordinator of services, and they make phone calls and home visits to assess a person's healthcare needs and eligibility. Then they work with a family caregiver to develop a care plan of appropriate services. Be aware that planning for health and personal care can be challenging. As you may already know, a person's health can change suddenly, throwing plans into disarray. It's important that you keep the case manager updated on a regular basis, especially if the person with dementia starts to require more care. If there are an increasing number of falls, or there's been an episode of getting lost in a familiar place, or any other changes that you notice, reach out and let your case manager know. During the assessment or afterwards, discuss both your current care needs, but also what services may be helpful in the future. During an assessment, the case manager will determine the person's eligibility for services, their health needs, and whether the person will be required to pay anything towards the cost of service. The financial part of the assessment can feel intrusive, and this list can feel overwhelming, but it can also help both sides of the assessment process if you're aware of the need for these documents and have them ready. You may not want to give this to the case manager in front of the person living with dementia, but you could pass them over when you walk them to the door or to their car. In getting ready for the home and community care assessment, gather all these items and have them ready to give to the case manager. These items are also listed on the Ministry of Health website. For example, a BC Care card, an up-to-date list of all prescription medications. You can ask the person's pharmacist to print out a list for you. war veteran or pension check stubs if applicable, most recent tax income notice of assessment, doctor's contact informations of close relatives or a friend. The interviewer may ask to see these items to complete their assessment and determine a person's eligibility for services. Activities of daily living are activities that each of us perform daily, but which a progressive dementia can make increasingly challenging. As mentioned, these are the activities for which home support can provide assistance. But it's important to think through what is actually meant by these things. We tend to want to protect the dignity of the person we're caring for, or to underestimate the complexity of these tasks. For example, if you're asked if your husband needs help with eating, you might say no, he's got a good appetite, he's easily able to hold his own utensils and feed himself. But in fact, when asked about eating, the question is really about all of the activities that go into eating a meal and includes meal preparation. Is your person able to plan a meal, go to the store, purchase the ingredients, come home, store them safely, raw meat in the fridge, for example, not in the cupboard, combine them into a meal, safely cook that meal, and then eat it and clean up? In most cases, by the time you're considering a home and community care assessment, the answer would be no, definitely they can't do all of that. And so it is with the full list of areas. Bathing. Do they recognize it as time for a bath, a shower? Are they able to manage it in the bathroom alone? Dressing. Are they able to pick out weather appropriate clothing, recognize when the clothes are soiled or need repaired, do their own laundry, shop for replacements? For each seemingly simple activity of daily living, the full list of activities that go into each is daunting and often is a very clear level of indication of the level of support someone needs. The interviewer uses a standard assessment tool during the assessment, even though it might seem like a casual conversation and you might forget that the assessment is taking place. It isn't unusual for questions to be asked subtly or indirectly. For example, the interviewer may ask a person with dementia to make them a cup of tea or get them a glass of water, and they're actually assessing functional abilities. Often a caregiver will leap up to be a good host. Please be aware that if the interviewer asks the person living with dementia for anything, it's part of the assessment. Try to bite your tongue, sit on your hands, and let the person try to answer or do what has been asked. Here are a few examples of some things that might come up in the different categories. For cognitive functioning, the interviewer might ask about memory problems or talk about day-to-day decisions like choosing when to wake up, when to eat, what to wear. Social functioning might be a discussion of any changes in participation in their preferred activities. The interviewer will be looking for signs of isolation from others, friends, and family. For changes in physical functioning, they are trying to look at the person's level of difficulty in meal preparation, their ability to do their own housework, manage medications, use the phone, as well as dressing, bathing, toilet use, climbing the stairs, etc. And they will also be assessing home safety and looking at all the things that may make the home environment hazardous. For example, flooring and carpeting, lack of railings, inadequate lighting, heavy street traffic, etc. Again, we can't stress this enough. Even though it might feel like a casual conversation over a cup of tea, try to keep in mind that this is a professional assessment with a very clear goal. So let's look a little closer at your own processes, some of the decisions to be made, and the discussions that will likely need to take place. So when is it time to access services? It is always better to access services early, as soon as you think you might need them. For example, contacting home and community care and asking for assessment relatively early can allow both the person living with dementia and the caregiver to go through an assessment and get some of those early questions asked. That way, you can introduce services when needed and can then build on those experiences and contacts for more services as needed. As for who decides which services to use, that would be a decision for the person living with dementia and or their legally appointed decision maker. A dilemma is a situation requiring a choice between two equally undesirable alternatives. Many people find the decision to access services a true dilemma. For a whole variety of reasons, you may not want to access services, and yet you are not able to continue with the current situation as it is. Emotions get stirred up in a tug of war between emotions and logic. You might know logically that you need some help, but emotions get in the way and make it hard to ask. But needing additional support is simply a reality because of finite physical and emotional energy. If you had infinite emotional and physical energy, you wouldn't need any services because you could do it all yourselves. But that is not the case in the real world. So I'd challenge you to reflect on what makes it difficult as you consider taking the step of accessing services. I'll share some responses that over the years, both caregivers and people living with dementia has told us about what it makes it difficult as they consider taking the step of accessing services. You may relate to some of these. For example, we've heard, I don't know what's available and I'm too busy or too tired or both to even look. Or the person with dementia refuses help. Or I think I should be able to manage on my own. Or perhaps I dread the intrusion of strangers in my home. I don't want this to be happening and I feel guilty or sad. As with so many aspects of the dementia journey, it is important to acknowledge the feelings that can get stirred up at this time. Many people feel sadness because needing help brings them face to face with the fact that this is a progressive disease and it is the very progression that has made services necessary. Others are very uncomfortable with the process of determining eligibility and the related questions that might seem intrusive. People have shared that they are uncomfortable with having strangers in their home. Their home has always been their sanctuary. Others have said that the services that are available are not a great fit for their needs, and they feel frustration and anger that their particular needs have not been accommodated. Whatever emotions arise for you in this process, acknowledging the feelings and talking about them will help. This might be a very good time to think about calling the First Link Dementia Helpline. It is a great resource to talk about the challenges that can arise during this process. Although the process of accessing services and support can be very difficult, there are a few strategies that may help. As much as possible, include the person living with dementia in the decision-making process, while also recognizing that dementia impacts the ability to make an informed decision. The parts of the brain involved with logic and decision-making may be damaged by the disease, and emotions might be very close to the surface. Remembering that this is a disease of the brain and that both the person living with dementia and the caregiver are impacted by those changes can give you both space to approach these discussions with compassion. Reassure the person that you want the best for them and want to keep them safe. For example, you might ask them to accept the service for your sake. While the person might not believe that they need the help, they may be willing to help you out. Acknowledge underlying fears and try and discuss the feelings openly. And remember that good caregiving sometimes means doing what a person needs, not necessarily what they want. Start gradually, introducing the topic in conversation and not necessarily engaging in a deep discussion right away. Think creatively about what might work. You know the person and can draw on a wealth of experiences. Persevere. Don't give up just because you encounter resistance. You may need to try a number of times and in a number of different ways. Be prepared to manage resistance on an ongoing basis. Even if the person previously participated in planning for increased services, the progressive nature of many dementias may mean that damage to their brain no longer allows them to understand the need for services at this time. Try to be aware of the emotion and feelings that are beneath the resistance and appeal to what they may be feeling, even if they may not understand why services are needed. You could experiment with phrases like, this is for me, I know you don't want help, this is prescribed by the doctor, or this is a free service, this is my friend who needs, or this is only temporary. Let's take a look at some real life examples. Here are some case studies. For example, Wynne continues to live alone in her home after being diagnosed with Alzheimer's disease. She's able to do this with the support of her two daughters. Over the past month, they've noticed that Wynne has not been taking her medications. They've initiated a conversation about having a person come to help their mum with medications. At first, Wynne refused to consider this idea. They continued to speak to their mum about having someone come in, and it took several conversations, but over time, Wynne accepted the idea. You might start that conversation by saying, I want to do what's best for you. I will take care of you as long as I possibly can. I want you to be safe and well cared for, and that might mean letting someone else help us. I just want what's best for you. Or another example of Isabella, who's been supporting her father to stay in his own home. She has arranged with the health authority to have a care aide come in and ensure her father has his meals. She is hoping to take some time away with her family for a week and has asked her father to consider spending some time in a respite hotel where he could have some social time and all his meals would be provided. He responded saying, "Oh, he's fine to stay at home on his own." Isabella offered to accompany him for a short visit and said, "Dad, you know that I care about you and I want to help you stay in your home. But I need to have some time away for my own health. For my sake, I'd like you to think about staying somewhere else for a couple of weeks. I just want you to be safe." Or let's take the example of Marge, who's her husband's care partner. She wants to support him to be at home for as long as possible, but is finding that with her own health issues, she's unable to keep up with all the household tasks and ensure her husband is being well looked after. She knows that her husband would help if he could. She asked if he could help her by accepting help from someone else on her behalf. None of us wants to be a burden, and so this gives the person living with dementia an opportunity to be helpful to you and to someone else. She said, "I need someone to help clean, but because my back is so sore these days, my friend Naresh needs the work to help out her family. I'd really appreciate if you could go along with this for my sake." Tiana's mom Lillian was diagnosed with dementia 5 years ago. She lives with Tiana and enjoys the support of her family. Lately, Lillian has been withdrawing from social and family life and is reluctant to go to her program. Tiana is concerned that Lillian is becoming more socially isolated and is hoping her mum will return to her day program. She knows her mum wants to be useful to others and often feels like she might be a burden. So she encourages her mum by saying, "Everyone at the centre is counting on you to go today. They need your help to get the work done." Although care workers have lots of expertise in their own areas, you are the person who knows yourself or your person living with dementia best. The very best care is delivered when care workers and family work together. It is helpful if you discuss directly with care workers about specific approaches or ways of care to help things go smoothly. That said, care may look different than what you are used to, but both caregivers and people living with dementia will adapt. It's important to recognize that just because it is different than how you thought it would be, it's not so bad. When you are planning for a meeting with a service provider, gather up a list of your questions and concerns and spend some time putting them into a priority order. It may be that there won't be enough time to get through all of your questions, so know which ones are key for you to discuss in this meeting. Emotions can be running quite high, so breathe deeply and be polite and respectful. However, respect doesn't always mean agreeing, and you may need to be respectfully persistent in asking for services. That said, get the big picture and understand how the services you are discussing fit into the continuum of care and services that might be available to you. Advocacy simply means speaking up for yourself or for somebody else. Time advocacy strategies carefully. Care providers coming into the home are on a schedule. Ask them whether you can have a few minutes or call to make an appointment to talk to your case manager to ensure that there is time to discuss your concerns. Be clear about what you want to achieve. You might even want to write out a bit of a script. The clearer you can be about what you want, the better for all concerned. If you're calling about a concern or a problem, try and have some possible solutions in mind. And be willing to compromise. Your solution may not be possible or preferable, and by being open to compromise, you may find a solution together that is even better than what you could have imagined. One of the key pieces of advice when communicating with someone who is living with dementia is to avoid arguing. The same is true of working with care providers. Build a relationship with the people coming into your home as best you can to have trust and a good working relationship. And inform caseworkers or case managers of changing needs for the people living with dementia. Think of yourself as part of a team with a role that you still have on that team. As the primary care partner, you are still the captain of the ship, you just have a bigger crew. You may have heard of the adage that you catch more flies with honey than with vinegar, and in that vein, caregivers have told us that they find it helpful to acknowledge what the care providers are doing as well. We all need to feel valued, and it can be helpful to start a difficult conversation from a positive place. Helpful tips that others have shared with us are to write down what you want to say before you speak to a provider and to speak to the person most likely able to make the decisions. And if you want to add a service or make a change, speak to your case manager. Be sure to take notes during any meetings or phone calls, and it can be helpful to follow up with an email outlining what you discussed or what your understanding of any decisions were. Keep copies of all important paperwork and store them so you can access them easily. And consider enlisting the support of others. Remember, though, that you know most about your family member and you are a key part of the care team as you access services. You are not inconveniencing service providers by phoning them or requesting a meeting, for example, with the case managers. It's their job to work with you to access relevant services. Advocacy is an important part of accessing services for a person living with dementia, and you need to advocate sometimes to ensure that you receive services to support you and the person living well with dementia. The Alzheimer's Society of BC has a number of advocacy fact sheets which offer tips on advocating for a family member with dementia. You'll find links to these in the helpful resources document linked in the description of this video. I want to touch on one more topic before we finish. When thinking about accessing services, it's important to consider personal planning. Personal planning is making arrangements for a time when a person needs help managing their affairs and needs involvement in all areas of life, including health and personal care, legal and financial affairs. Many families reach out to the Alzheimer's Society of BC when they are in crisis. Often they have not considered planning ahead. Our goal is to help motivate you to start thinking about personal planning now so that you can learn where to get information and support. Now is the best time to learn about the tools that are available to you, and planning is best done in advance of any times of crisis. Because of the progressive nature of most dementias, the person living with dementia will almost certainly become incapable of making healthcare decisions, including those relating to accessing services. It is important to have conversations with the person with dementia as early as possible so their preferences are known, and to plan ahead to ensure that you have the legal authority to make decisions on behalf of the person living with dementia. Personal planning gives family and caregivers confidence that they can know what they are doing and they're doing their best to honor the person with dementia's wishes, and gives the person living with dementia the comfort of knowing that they have shared what they want to happen to them. There is a good series of recordings on our website that go into detail on personal planning along the dementia journey. I'm not going to go into detail on this today, but I encourage you to get more information because this is such an important piece. Thank you for watching, and remember, if you have any questions or want to talk through how all of this relates to your situation, please reach out to the First Link Dementia Helplines. In English, it's available at 1-800-936-6033. Thank you.